Okay, good morning. I'm Susan Blum. Welcome to my home office. This is where I'm living these days. Like all of you, I hope you are safe and tucked away in your own homes, and I hope you have some personal space for yourself in your own home. Some people are really living in very small quarters in the cities, and that's really hard. That's hard, especially if you have multiple people, and so. Find a way to get some time, alone time, even if it's going for a walk right outside your apartment building, or some way to sort of get outside or get space where you can be alone. Quiet time is really key. So this is my little hidden space in my house. This is where I meditate in here. I work in here, and I talk to you from here. And I have a great view out the window, and I have to say it's April 10th. I need to mark the moment because we're going to talk about the coronavirus pandemic, COVID, the disease, and today is April 10th. It is Good Friday. So happy holidays to everyone. Happy holidays for Passover people. It's Passover. So we have probably, well, I think even there's a Muslim the Muslims have a religious holiday in here too. I'm just not as familiar with that, but I read that I know Christians and Jews right now were sort of have a holiday week, and I think there's other religions as well that are also celebrating this week. And so we really have this global spiritual moment in a way, for us all to, religious holidays tend to be introspective, bring us inside, slow us down, connect with family. So it's April 10th. It's Good Friday. This Sunday is Easter. Wishing everybody here a good Passover, good Easter, good holiday. And I'm hoping you all are connecting with your family. We had a family Zoom. I'm Jewish, so we had we did our Seder here for 3 people, my husband and my son. The 3 of us are living here, and we did the whole thing, even though it was the 3 of us, and it was really sweet. And we had a good conversation about the meaning of this moment. And this is an opportunity for us all to talk about all that, and to go inside and connect with family. And then after dinner, before dessert, like with dessert, we all ate dessert together. Our whole collective, we had 1, 2, 3, 4, I think 5, 1, 2, 3, 4, 5 homes with different groups of people all chatting. So looking out my window, I have daffodils blooming. It's spring, even though it's cold again in the Northeast. I think we're a week or 2 away, and I plan on working in my garden this weekend. One of the things I've done for my own self-care, and if you live in a house, this is another thing that you can do, is for the get outside and get space to yourself. Plant a garden. This is the best. And if you have an apartment and you have a windowsill or a terrace, you can start seeding in the house now. So I got these I figured out how to start seeding seeds, and I have the seeds coming, and these little starter pot things to get it going. And I'm going to start my seeds and start planting outside. So I'm actually going to be much more into my garden this summer. I'm going to farm. So figure out how to do that. And my kids I have 3 boys, and I've seen their windowsill pots, in their apartments over the years. And so good. So that's my little opening about personal. So that's just saying hello and connecting with everyone, and hoping you're all well, hoping you and your family are all well, and everyone that you know are all well. I'm not sick. Anytime is this happening in your house? Anytime somebody coughs, they go, I'm okay. Not a cough. I don't have a cough. That's just me talking quickly and getting a little dry. Okay, so welcome. So those of you who've joined before, and those of you listening for the first time, the way this is going to go is I'm going to give some updates first. So it's my opening monologue, I call it, Dr. Blum's opening monologue, where I sort of share what I've been reading, what I've been thinking about, and what sort of going through information to try to help you understand what you're listening to on the news. And then I go and answer questions, and we stay here until all the questions are answered. I'm going to try, I said this the last time, but yet I had a lot to say. I'm thinking I'll just I'll try to keep it brief, because it is Good Friday, and last time I think 2 weeks ago, I was an hour and a half. Last week, I was an hour and 15 minutes, or maybe just about an hour. So I'm going to try to definitely stay within the hour. Um, so let's see, what do I want to talk about this morning? Two big thoughts are on my mind today. The first is about sort of public health and this whole idea of mitigation, and is the curve flattening, and what is it? What's the next step, right? And I think we'll talk about that first. And then I want to talk about just our general understanding of who's at risk. How do you protect yourself from getting really sick with the virus, right? And so that's where functional medicine really shines. And so I'm going to end there. So let's just start with the sort of straightforward, dry stuff, which is the public health stuff. So, as most of you know, you've heard this term mitigation. And what does that mean? It means trying to blunt the curve, trying to slow the spread. So we're in, and you do that by social distancing. So we are in the mitigation phase of the public health approach to pandemics. Okay, the public health department has been around for a long time, and the public health efforts for managing infectious diseases have been around a long time, and so these are the strategies that we use. And so you're in mitigation, and when you get the number of new cases are low enough, and one of the terms that are being thrown out, you might have heard about, is this R naught. And it's really just the infectivity of the disease and where you're at. And the idea is that one person who's sick, how many people do they get sick? And right now we're somewhere between 1 and 2, but we're under 2, which is really good. I think we were up to 6 at one point. And so the spread has come down. One person isn't infecting so many people. And I believe that the goal is to get it under 1, which means really for each person who gets sick, they're not even getting one more person sick. It's less than that before we can move into containment, which is the next phase. And so there's sort of numbers that we're looking to see to get down to in order to believe we're ready for the containment phase and that we can move out of mitigation. And that's straight statistics. Those are straight numbers. The good news is that the curves are flattening everywhere. The only curve that's not, so there's multiple curves. There's a curve for how many people going into the hospital. There's a curve for how many new cases are being diagnosed, which is only subject to testing, right? You can only diagnose a test that was done. So our limited testing sort of limits the new diagnoses. And so that's a hard one to follow. But we do know the people coming into the hospital, that's a very sort of concrete number that we can look at. And as we're doing more and more testing and our testing catches up, which we'll talk about shortly, we have to talk about testing, we will get more accuracy about the number of new cases. But right now, the curves are flattening for the number of new cases. The hospitalizations in New York, they're down a lot. And the number of people going into the ICU, down a lot. Our healthcare systems are starting to recover. That overwhelm in another few days of this, and I think that our brethren, my brethren, and all the people in the hospitals and all our healthcare workers in another week are going to be able to certainly in New York and in the current hot spots, and we're hoping that'll stay true for places that are not hot yet, don't ever get there. But the healthcare systems, we hope, have seen the worst of it. We're coming over the mountain. And so that's really hopeful. So that's really good. The problem is the deaths. You're going to see every day a lot of people dying, and the death rate, the number of people dying, lag by 1 or 2 weeks. You've heard this before, I'm just saying it again. The number of deaths lag a week or 2. So that's that. And so the next step, so I don't know when this is going to happen, when we can move into containment. I think we're definitely a few weeks away. I keep predicting to plan on it being the end of May, because here's what needs to happen to move to containment. First, you have to see all these numbers go down. So we have to keep social distancing. There are areas of the country that aren't really social distancing. So in the next week or 2, we have to see whether there's any hotspots that emerge in the country that can actually reinfect New York or reinfect California, people moving around. So this is why the lack of a federal response has the public health people all sort of upset, that it's state by state, because people move back and forth, and you fix it in one place, what makes, the second wave can come back because people come from somewhere else. And so that's a bit of a concern. But the big thing about, so mitigation, which is the phase we're hoping to come out of, this first phase of social distancing. When we get through this part where the numbers show that we can move to containment, there are practices that need to happen. What does containment look like? That's phase 2. And that's what we're hoping happens this summer, right? So this is what happens when we get out of the house. In order to get out of the house for the containment phase, there has to be widespread testing available that costs nothing, right? So it has to be free. It has to be accessible to anybody who wakes up with a sniffle. Like you have a little fever, you don't feel right, you have a little sore throat, you have a little cough, you go get a test, like immediately, and you get one, and you find out the results quickly, like within 2 days, right? None of this. Right now, people can only get a test if they're really sick and they wait 5 or 6 days. I mean, it's ridiculous. So you have to be able to test everybody who is showing the first sign of symptoms, tell them quickly whether they're positive, and you quarantine them. And then you need an army of public health workers, right? We need a public health workforce. And I've been reading that they're working on building the public health workforces in each state so that they can contact everybody who's positive and then trace their contacts. So anybody who's positive and their contacts, people they had direct exposure with, they stay home. And then everybody else gets to go out. And so the only way that everyone else gets to safely leave is if the people who are sick are identified and they stay home. Okay, so it's a big public health project that we are far from doing at this moment. And so in order for containment to really work, you need all those things in place. The other piece to containment, or when we safely can start leaving the homes, is antibody testing. And what is that? Antibody testing is finding people who are immune. They're starting to now do surveys. There's some studies being done now looking at the different groups of people around the country or the places where there have been hotspots. And the range is somewhere between 15 and 25% of people that they're surveying have immunity. And so in order to develop this thing called herd immunity, which just means enough people are immune so that the virus hits a roadblock and can't keep traveling, right? The virus has to hop from person to person. If it lands on a person that's immune, it can't keep going, right? So the virus will naturally extinguish itself if enough people are immune. And the process for getting immune is getting the virus or getting an immunization. We're not going to get an immunization for a while. And so we have to get a handle on who's immune, because if you're immune, you can go back to work and you don't have to worry. And so in the next month, I think we'll have a lot more data about immunity, but that's really a key part of the containment strategy. After mitigation, and we go to containment, we contain the people who are sick, we let out freely the people who are immune. The high risk people have to still be really careful, and the health system is prepared for more people getting sick. And the virus, we have to expect, is going to stay in the community at a low level even through the summer, and maybe even surge again in the fall. But it will never, hopefully, be like this was, because more and more people will be immune, more and more will have better and better treatment. I'm going to talk about treatment in a minute. And we'll have really good public health surveillance. And so I will be reporting on that every week. So every Friday you can come back here and I will tell you where we're at with how close we are to having a good surveillance system in place. Until I feel there's a good surveillance system in place, I'm keeping my Blum Center for Health. We are all virtual. It's going great. We are fully set up. We're not seeing patients in the office. We're all, functional medicine is a great medical, we can do this by Zoom as easily as seeing you in person. And so everybody, we're all busy working at home, but I have 3 or 4 of my clinical team, the admin team and the medical assistants, and they're all in the office with the doors locked, shipping supplements and making appointments and running the back end of things. And I've been very careful about keeping an eye on everybody and making sure everybody's okay. And so I'll let you know when I'm ready to see patients in the office again, and I'm ready to go back myself into the office. I'm not seeing it yet. And so that's sort of my good news and bad news for the day. I will tell you every week. I will interpret it for you. I'll tell you when I think we're ready to move out of mitigation and into containment. There's a lot of good people talking about it. In terms of public health people, they know what needs to be done. Everybody's talking about what this means and how to do it. The problem is, it depends on what state you're in. I'm in New York. I trust Governor Cuomo. He gets it. He knows what needs to happen to get to come out of the house. But not every governor really understands this, and certainly the federal government is not providing leadership on this either. So it's really state by state. So I hope for whoever's listening, I hope that your governor understands when it'll be time. That understands not to reduce the social distancing until the containment plan and program is actually in place. Okay, so enough about that. Before we move off of public health, and if there are questions on that, I can do that when I go through my questions. About the second piece about public health is about, well, two more things, testing and treatment. I always go over this for you every week. The testing. So there's two kinds of testing. I said this last week, so I guess there's new people sometimes, so I'll repeat and I'll say where we're at. The testing for the virus itself is becoming a little bit easier to get, certainly in my world. So I now have test kits I can send people from my office. It's a throat swab. You stick it all the way down into your throat, and you can send it in. We have a genetics lab that we have kits now from. So if you're a patient of Blum Center and you want to have a COVID throat swab test, you can definitely contact your practitioner or anyone at our office and ask for the kit. I believe it's $99, so it's private pay, and you have to be a patient to order testing from us. If you're not a patient, you can become a patient. I created this whole new easy way to become a patient at Blum Center so that we can support you during this time. It's called an immune consult. It's a 45-minute for $295 with our health practitioners. It's not with me, so I'm sorry, but my team is fantastic. And basically, if you're interested in learning more about that, just go to my website, blumcenterforhealth.com, and I have a whole new page on telemedicine and also about the immune support consult. And you can just read about it, and there's a link about how to go inquire about how to do that. But the testing, all this kind of testing, which we're going to be able to offer our patients, you need to be, I can't order it for you unless you're an actual patient at Blum Center. And we actually need to have seen you in 2 years, but that's okay. You can contact us and we will walk you through how we can help you. Okay. So testing, COVID testing. Right now, it's still hard to get a test. If you're really sick and you have the symptoms, you can call your primary doctor or a hotline, and most people I know are getting tested for that. Good. Takes 5 days still to turn around, but okay. It's my understanding that there's still a huge limitation in the swabs, and I don't know we're ever going to be able to get to the point where we can test everybody for that. Hopefully we'll get to the point for containment where we can test everybody who's sick. Not, you have to have some symptom, but accessible testing, we're still not there. And I think we're a month away. I don't see any sign that everyone's going to be able to get a test who needs one. If you don't have any symptoms at all, that's not the test for you. If you don't have any symptoms at all and you want to find out if you're immune or if you were exposed, maybe you had a cold a month ago and you're not sure if that was it, that's the antibody testing. That is coming. I actually have that in my office now. Like, I could do it in my office, but we're not open. So I've just been doing antibody testing on my team. In about a week or two, we're going to have antibody testing kits that you can do by finger stick to send you to your home. Because the problem is the offices aren't open. Like, I'm not open. I'm not bringing people in for blood draws right now. So eventually I will. Come the summer, we'll be open. We'll be able to do antibody testing. I think hopefully by the summer, we're going to have antibody testing available for you through your primary care doctor as well. But I think in the next, 1 to 2 weeks, I'll be able to send out immune antibody testing kits. That's going to be really important for you to know if you've been exposed, if you had it, if you're immune. And then you'll know if you can go out of your house and go back to work or not worry about going to the grocery store, and that kind of thing, because the people who are immune are going to get to leave the house. That's part of containment, right? The containment phase. Find out if you're immune, you get to leave the house. People who are sick, they stay home. Okay, so this is part of what's coming. This is our next step. Until this whole pandemic is over, we're going to have this in-between, sort of this in-between phase where we're doing, this is what we'll be doing. We'll figure out who's the highest risk. You stay home. You be really careful. The immune people, you can really leave. Monitor people, catch them really early. If they're sick, do quick testing and contain them. and everybody else wears masks and is very careful when they're out and do somewhat of social distancing, gets a little relaxed. But that's what I think we're going to be in for this summer. I know, I know. But a year from now, hopefully we'll have a vaccine, we'll have treatments, we'll look back on this and say, wow, what was that? Right? Which then leads me into the next thing. Well, actually, I'll do treatment for a second and then the next thing, which is really about how do you become a low risk person if you're a high risk person? That's really what we can do now, right? So, so the last thing about public health in terms of treatment, we're not really very far along in terms of studies on treatment. I will tell you that in all the hospitals, because I have lines in, I'm on staff at Greenwich, I know what they're doing, I know what a lot of the hospitals are doing. There's a lot of clinical studies or clinical reporting being done. All of the hospitals are using Plaquenil with an antiviral. You go into the hospital, you get put on Plaquenil and an antiviral. Remdesivir is the one that's being studied. It's just the name of one of the antiretrovirals. It was the one that was studied for Ebola most recently. So that's happening. Like you go into the hospital, you get put on those two things. And they're studying, and there are places where they're doing it in a randomized way. Not everybody is. They're keeping some control groups to try to figure out if it's really helping. It looks like both of those things are only helpful early on. So meaning as soon as you get sick, I don't know, for some of you who know about a Tamiflu, like for influenza, you have to do it like the minute you get sick, like day one. And so that's for influenza. But this new antiviral that people are using, once you're all the way down the road and you're really sick and having trouble breathing and might end up heading to the ICU, those two medications are not showing promise there. Okay, so I just want to say that. And so we'll know more about that. I'll know more next week. But for now, it's looking like those are promising for early on, and we're not really sure yet. Those are antiviral treatments. So the antiviral treatments are for early. The one that's really being put into place very actively right now for antiviral, but when you're really sick, that's the serum from the immune serum, right? The taking blood from someone who had it and then putting it back into giving it to someone else, right? So people are donating blood. There's huge blood. The Red Cross has taken this over. A lot of hospitals have been sending out alerts to please notify them. They're trying to collect serum from people who are immune. It's been over 100 years that this approach has been used in a crisis. And so, so that's happening, and that's looking very promising as well. That seems to be working for the sickest people. And then the last one for the sickest people is the anti-cytokine, like, the rheumatoid arthritis kind of medicine. And they have a whole lot of names to them. And so those are being used for people who are heading to the ICU that we think are in cytokine storm. So people who decline really quickly, they have IMAB at the end of their names. They have all sorts of names to them, but they're IL-6 anti-cytokine sort of medication that squash that whole cytokine storm. And so that's also for people who are very sick. So, and they're using that. That's being used. So all these four things I'm talking about, these four approaches, they're all being used in all the hospitals. And I will say that people are leaving the hospital, less people are staying, the hospitals, and less people are going into the ICU than they were before. And I don't know if that's because of all the different treatments that are being done, or if that's because there's just less people that are coming into the hospital, and we're seeing the backside of the mountain. But it looks like the numbers, and so we have to wait and see, but there's definitely less ICU admissions, at least in New York. And so I'm hopeful that some of these treatments we're going to find out are working. So there's the update. All right, so for the last part of my rant, and then I see there's a lot of questions and I'm going to answer them all. For the last part of my rant, or my opening monologue as I call it, I want to talk about what we can do, right? Because we're all going to be home. We all are home. And here's the thing. So let's just talk about virus and virus infections and viral disease, okay? Viruses have been around. Wait 1 second. I just want to, because I got all these dates in front of me. I collected my dates. Viruses have been around there have been viral pandemics. The flu, influenza, 1918, 1957, 1968, and then we had SARS in 2009. Viruses have plagued us like through the history of man. HIV is is a RNA retrovirus. That's still unresolved. In 2018, 34 million people were, clocked in as being infected with HIV, and there were 770,000 deaths. So we don't talk about HIV very much, but it's still very much present. We don't have a treatment for it, and we don't have, we have a way of sort of keeping the virus in check. But one of the things that's come out of learning about just chronic HIV in the population, and even about influenza, is that there are other factors that end up causing people to get like sicker, or have like the disease, right? And so to have a viral illness and to be sick from a virus, you have to have the virus. And then there's two other factors that intersect with whether or not you get really sick. One is the social factors, things like, where you live, and are you taking the subway, and do you have access to healthcare, economics, right? So there's societal factors that put you at risk. Socioeconomic status, I think I just said that. So there's social factors that intersect with risk, which we're learning more and more data actually about COVID and coronavirus and the people who are dying. And racial data we're still waiting to get, but it's looking like the hardest hit communities are the poorer, minority populations, lower socioeconomic. And then the third piece is biologic factors. So it's the virus plus social plus biology. And what is the biology part? That's the stuff I talk to you about all the time. So this is modified. And so the question is, so things like food, stress, gut health, toxin load, right? Are you sleeping? All the things that affect your immune health and create resiliency in your system. This is your biology. What is your terrain? What is your ecosystem? What's your immune terrain look like? If any of you have been following me all these years since I wrote my first book, The Immune System Recovery Plan, and this is going to be, I never go around pitching my stuff. Most of you know, I don't pitch my books. I just, maybe I'll mention it. But I wrote that book in 2013 and I updated in 2016. I think I added some stuff in 2016. But that book is how to build immune resiliency, right? It's how to have a healthy and strong immune system. It's definitely a whole, it's about treating autoimmunity, but it's also, I talk all about how to have a healthy immune system. And it's all about modifiable lifestyle factors. And so the fact is that while we might not be able to control, we're trying to, whether you get exposed to the virus, whether or not you end up getting really sick, and even whether you're at that highest risk of mortality, depends on some of these social factors, which maybe you can't modify, but then there's the modifiable biology in your body. It's the lifestyle piece, because you can improve your blood sugar, you can improve your blood pressure, you can reduce your cholesterol. These are the cardiovascular piece. There's a huge increase in risk. Obesity and weight gain, you can control that. Smoking, you can control that. And so the people who are succumbing and getting the sickest from this disease and ending up in the ICU are the people with all of these. Maybe not smoking isn't landing the people in the ICU. I didn't see smoking with people in the ICU, but it is an increased risk factor, right? But definitely in general for being sicker. But the ICU are people that have hypertension and obesity, or overweight, have pulmonary disease, cardiovascular pulmonary disease, okay? And a lot of people get there because of lifestyle. So let's start working on resiliency now. Let's start doing it. And so the way we do it is we look at functional medicine foundations, right? This is what I talk about all the time. And this is how we work with you in functional medicine, which is why having access to a functional medicine person to take you through this is a great opportunity. But the other big opportunity is go buy my darn book, because it's as relevant now as ever, right? It's on Amazon. It's easy. All right. The Immune System Recovery Plan. Learn how to fix your immune system, create more resiliency. And so the Mediterranean whole foods, high antioxidant rich, high fiber rich, polyphenol, multicolor diet. Okay. Plant forward, less animals more inflammatory. I'm not saying don't eat animal, but I explained so much about this. Okay. And so an antioxidant, fiber rich Food plan, that's plant forward, helps you get rid of toxins. Stress, getting a good night's sleep. This is why I was saying when I opened my monologue today, right? Make sure you're getting outside. Make sure you get a little time to yourself every day. Don't, if you're in small quarters, find a way to get a little me time somewhere in your day. Whether it's, and then you can, if you're all in the same house and you can't get out or apartment, you can put in headphones and just pretend you have a bubble around you, or go in a room and close the door and listen to a guided imagery. So stress, that's the whole stress piece. Number 3 is your gut microbiome. Healthy gut is a healthy immune system. Healthy gut, healthy immune. Healthy gut, healthy immune. Healthy gut, healthy immune. I've said it 100,000 times. And so how to heal your gut is something I'm very, very aggressive with. If you want to do that yourself and not work with one of our practitioners, I have a second website that does all my online programs. So that's blumhealthmd.com. Blum Health MD has a do-it-yourself heal your gut program. Go do it. If you have digestive symptoms of any kind, you have reflux, you don't move your bowels every day, you have gas and bloating after you eat, maybe you need a gut reboot, okay? So, or take a probiotic, right? Probiotics are influencers. They're really good for your immune system and help you support your gut immune system. And then toxins, lower your toxin load, whether you want to, part of it's cleaning up your world, right? So you have to really make sure you're being careful about what you're exposed to. And my book, it's a 4-step program. So my book takes you through each of these things: what to eat, how to figure out what to eat, how to manage stress, how to heal your gut. This is all do it yourself, right? And how to support your detoxification process in your body, how to do an assessment to see whether or not you have a high toxin load. I have a lot of that stuff on the website. Blum Health MD is my book website. It has all the do-it-yourself stuff. And so these are really important things. And in the book, I really explain how toxins and how gut health is all tied into immune health. And so this is where, my shameless pitch for that. A book doesn't cost a lot of money. Go, leave time. Learn more about how to build resiliency. This is how this virus is going to be around. So getting really sick from a viral illness or any kind of infection is a combination. I'm going to wrap this up with a summary. It's the infective agent, which is the virus, plus your social factors, which maybe you can control, maybe you can't, how closed in you are with people, how you live, where you work. But there's the biological factor, and those are modifiable for most people. If you're overweight, it's time to start losing weight. That'll help you with your blood pressure. That will help you with your cholesterol. That will help you with your heart. So there's all sorts of ways I'm here to support you with all that. And so that's my pitch for that. It really, really important. I'm not going to go through the supplements again. So I would just want to help you, with what you can do, because, the unknown or helplessness is what causes the fear. Helplessness is what makes us depressed and anxious. Let's empower ourselves to be able to do something about it. And if we can reframe how we think about this COVID thing and understand that there is something you can do to make yourself more resilient and less likely to get very sick. Like I said, the estimates are up to 25% of people don't get sick from getting infected by the virus. What makes them different? And from the HIV data, the AIDS data, we know, and so this is where some of this comes from that I'm talking about, we know that the people who get sickest are the ones with the poor, these modifiable lifestyle factors. The healthier lifestyle people end up getting less sick from the HIV than the people who aren't. And so you have, I know it's hard. This is not judging some of you. It's not going to be an easy thing to switch your lifestyle and how you're living. But every journey starts with the first step. So even just working on the food, while you're home. And actually, I will give you another shameless pitch. I have a fantastic health coach at Blum Center. Go on my website, Blum Health MD, or even at Blum Center for Health. Any which way you can contact us. She'll work with you. You don't know where to get started? Have a coaching consult. Very easy peasy, okay? Low barrier to entry. We're making everything as easy as it can so we can support you. I want you all to increase your resiliency and be able to, fight this virus if and when you get exposed, okay? Last thing about the supplements, I'm stick with what I said last week. The ones that we know are excellent and are still coming in strong with everything we're reading. Vitamin C, Everyone should be taking vitamin C. I'm telling everyone 2 to 3,000 milligrams a day just to walk around. If you think if you're out working and you're getting constant exposure, take as much as you can until you get diarrhea. If you're sick, go up to 6,000 if you can. Sometimes a powdered one is easier. It's really hard to find. If you're out of vitamin C and you can't find it anywhere, you're welcome to email my office or call my office. We take our team at the office is shipping stuff out. I'm all resupplied. You can email us at admin, ADMIN, at blumcenterforhealth.com and just send in an order or call, and we'll leave a message and we'll get it out to you. We've got zinc in stock again, more coming in this week, 15 to 30 milligrams of zinc every day. There's a study being done now with Plaquenil. They're giving Plaquenil, zinc, and vitamin C, and we're waiting for those results. It's actually in process. Apparently, zinc helps Plaquenil work better. Not many studies with the zithromycin. I'm not sure if that really caught on much about that. That's separate. But zinc seems to work well with Plaquenil. Last time I reported about curcumin and melatonin and quercetin to help with cytokine storm. And so that's really good. And, especially if you get sick, it's good for prevention for sure. And then you can just really up the dose. Quercetin is like a 200 milligram a day dose, and then you can go up to 600 milligrams a day if you get sick. Melatonin, anywhere from 1 to 3 milligrams is a daily dose. And then you can go up to 6 or even more milligrams a day, probably 6 if you get sick. This keeps you, especially if you get very sick, these are the things that will keep your immune system from the runaway train. And then, of course, turmeric and curcumin we love. And that's just a basic 500 milligrams a day, and you can go up to 1,500 milligrams if you get sick. So vitamin A is making a comeback. The preformed vitamin A, retinol palmitate, I think anywhere from 1,500 to 3,000 a day. It's probably in your multi. Don't go running out and buying another. Don't add that in. You'll see you probably have it in something else. I'm not telling you to go buy yet another thing. But I just wanted to review the things that are working. All right. Sip of water, and now we go to questions. Starting at the top. All right. Hi, everybody. Hello, hello, hello. And by the way, if you write it to panelists only, I won't say your name. If you send in the question to panelists, to everyone, you see you can choose what you're sending it to. I might say your name. And so if you say to everyone, I assume you mean that because everyone sees your name if you do it to everyone. Okay. So, thank you for doing this. I went shopping yesterday in gloves and mask, and I realized it only too late that all the plastic bags and plastic containers were touched by my gloves. I faced either letting all my food go bad or putting in fridge and refridge. How much have I exposed myself, and what can I do about it? Okay, so here's the thing. When you go shopping and you bring all the plastic containers and plastic bags, don't worry about it. You bring it all home and put it down on a table in like the dirty area. So you just unpack everything and put it there, right? What I do the first thing is when you're shopping, you have your gloves on and your mask. You put everything in your car, and then you take your gloves off and Purell your hands or use a wipe or whatever before you get into the car, right? Wipe your handles on the car. So all this stuff from the store is just in your trunk, and don't worry about it, right? But make sure you're clean and clean your hands, and then get in your car. So when you get home and you start unpacking everything, put on another set of gloves and just put it in an area and just start unpacking everything. And I actually do have wipes, and I wipe down the stuff that's in a bag. You just dump it out of the bag into the sink. Everything that's produce, I just dump into the sink and I wash it all. Okay. And so I just dump all the bags out and put everything in the sink and around the counter. And then I throw those bags in the garbage, and then I take my gloves off and wash my hands again. Right. And so all that stuff, then you just wash it and it's fine, and put it all away in the refrigerator. So there's no reason that you have to worry about that. And so I just dump out everything from the bags. Things that come in a plastic container that I touched, I just take a wipe. I do wipe those down, or I open the container and stick it in. But things that are the things that are just packaged things, I tend to, wipe those down myself. You can run them under water, soapy water too, if you want. Or wipe them down. And so, yeah, I've been doing that. But then you just wash your hands. You know, it's just about, it might be on your hands. Just don't touch your face while you're doing it and just wipe everything down. There's absolutely no evidence that people are getting sick from food, okay, or from going shopping. Your biggest risk is being close to someone else in the store. And so just getting yourself out of the store, and I also bring wipes, and I wipe my hands in the middle of while I'm shopping. Like every 5 minutes I do another wipe, even though I have gloves on. So I'm always wiping my hands in the store and Purelling even over my gloves. And so I think that if you keep decontaminating your hands as you're going, when you touch things, you're not going to touch them. So listen, you're doing the best you can, but and so far it's working, because we're not getting sick from going grocery shopping, you know, as long as you're practicing social distancing in the store. Okay. And so don't worry about that. Putting it in the freezer and fridge, if you leave it in there for a couple of days and don't touch it, that's also fine. Most of the virus is going to be gone. If there's any virus on any surfaces, really 24 hours should do the trick. Definitely in 100% 3 days. The longest is really 72 hours, but most people are saying 24 hours is fine. But I wipe things down, and I just keep washing my hands whenever I bring things in. And so it's really, let's just, you know, we can become a little less fearful. As the case rates are going down now, I also thought about this. I'm going to go to the store. I haven't gone in 2 weeks. I've been getting deliveries. I am going to go out on Sunday, because I keep getting deliveries and they don't have some of the things I really need. And so I'm going to go out. I figure it's Easter Sunday. I'll go at 8:00, and I'm feeling less fearful, because there's less people who are sick now walking around. Like, the cases are down, right? And a lot of the people that have gotten sick from 2-3 weeks ago or haven't made it, they're either better or they're in the hospital. And so the new cases have dropped a lot. And so with the quarantine, so I just think we're going to not have as much exposure in the store as we used to, but you still have to be really careful. During containment, if you have not acquired immunity yet and you have an autoimmune disease, should you still stay home? Can those with immunity still be carriers? Good question. Those with immunity can still be carriers if depending on how long it's been, right? And so immunity has something called IgM and IgG. IgM is at the early stages of being exposed, you know, after you got exposed, and IgG is at least 14 days. And it's in the history of the way we've always thought about this, you can start getting IgG as early as 14 days, but it really is more like 30 days, okay, is how I've always thought about it as an immunology, you know, a specialist, I guess you can call me. But when you do your immune test, it'll tell you if you're IgM and or IgG positive. If you're IgG positive, it's been a while. It's been long enough since you first got exposed. You can pretty much believe that you're not shedding anymore, you know, and you're not going to give it to anyone. If you're only IgM positive, it might still be within the first few weeks of when you had it. And so, so we actually had someone IgM positive this week, and I sent out a throat swab on her to see whether or not she thinks she had a cold like March 16th. Like, we're trying to figure it out, right? And so it might be that if you remember being sick, you have to count the days since you've been sick. So there's two things at play. So first you have to decide if you're immune. And I would say you want to wait till you have IgG positive to decide you're going to go out and be immune anyway, because that's the stronger immunity one. So IgM just means that you were exposed, and that tells you something. You want to be IgG positive before you let yourself go out freely into the public, because then you know it's been a long enough time. You're not going to be spreading the virus, and you know you have the strongest immunity. So that's probably the easier way to answer your question. So if you're IgG positive, then you're probably safe. If you're only IgM, that's a tricky thing, and you might need help interpreting that with whoever gave you the test. And then you might need a secondary test to just test you to see if you currently are sick or currently have it in your throat. So I hope that answered that. I'm sure there's going to be more questions about that. The other thing about during containment, your part 2 of your question, if you have not acquired immunity yet, and you have autoimmune, just because you're autoimmune doesn't put you at risk. It puts you at risk if you're on an immunosuppressant medication. And that's the other big category of people. We have so many people taking it. So if you're on prednisone or you're taking something that's an immunosuppressant, that's a problem. Or you're on one of the medications that suppress your immune system. Even there's other classes of meds. And so if you're on immunosuppressant meds, then you're still considered high risk. Just having autoimmune disease does not place you at high risk unless you have one of these other things. So you're in that middle zone where you're going to go, you can start venturing out during containment, and you're going to really be careful and monitor. If you develop symptoms, you develop a fever, I'm probably going to get a infrared temperature scan. That's what they're doing in other countries. If you go back to work, everyone should have their temperature scanned every day. And so I'm going to scan everyone that comes in my door, even if when I open to patients, we're going to scan foreheads. It doesn't touch them. Anyone who has a fever or any kind of 99 or above, they don't get to come into the office. So that's the way Singapore, the people waiting in the airports in Asia, that's the way the government has been screening people as they come in from other countries when they get off the plane. It's a temperature scan. That's what they did in the SARS outbreak to contain it. It's a temperature scan. And so I just ordered an infrared temperature scanner. And so there's things we're going to do for containment. But you'll be allowed to go out, but you're going to have to be careful. It's out, but carefully. Okay. If so, does that apply to all autoimmune diseases? Okay, that was the conversation about that Nancy and Julie asked about autoimmune. So the only thing I will say to anyone with autoimmune who are listening, and those are certainly my followers because I'm an autoimmune specialist, if you have any other, it's really again about medication and the status of your inflammation in your body. If you're like someone with Hashimoto's who just has Hashimoto's antibodies, in treating autoimmunity in people, the question is, why are you autoimmune? And that comes back to my book that I was talking about before. Are you eating the right food plan for yourself? Are you managing your stress? Do you have a problem with your gut microbiome? So people who are autoimmune do have gut imbalances. People with autoimmune do have a high toxin load. Those are two things that are below the surface, right? Your autoimmune condition is the top of the iceberg we see above the water. But what's under the water? What's triggering the autoimmunity? And this goes back to what I was just talking about building resiliency. So you're not like quote unquote a high risk person unless you're on medication that is an immunosuppressant. But you are what I would put in terms of the biology of resiliency. I would want to see you do more to build your resiliency. And so this is where I want you to do more to make sure your gut is healthy, because it might not be. The autoimmunity is a tip off that your microbiome needs help, improvement, and that you might have a high toxin load that needs to be reduced. And I can help you with that in the book. I can help you with that in my office. I can help you with that on my website. Okay, so working on your resiliency is what I need all you autoimmune people to do. But from the purposes of, are you more likely to go into the ICU? No, not. And do you need to stay home because you are designated as a high risk person, more likely to go into the hospital? No, only if you're on an immunosuppressant. All right. So what's your assessment of how long immunity will last if a person has had COVID? I don't know yet. Check back with me next Friday. There are studies now looking at that. And so they're looking at, and a lot of that's happening in Asia, where they're measuring immunity on all the people who, had it. So they're determining the level and robustness of the immunity after you got sick and how long the immunity lasts, and that we have to do a quantitative. So what I will say to you is that historically speaking, if you are positive for the immunity, right, IgM and IgG, it usually lasts through this first year, right? It'll last you 3 to 6 months, like through this first and second wave, until this first year is over. You should be fine. Typically, that's the way this works with viruses. The reason why it would stop working typically is because the virus mutates, which we haven't seen happen yet. But it's usually after the first season or so. I would say you're going to be good for 3 to 6 months, and stay tuned. There's more information on that coming. But we believe from past viral pandemics and the way the flu shot works, you get the flu shot in October and it's good for that season. right? But by the next season, it's no good. And so that's sort of, we're thinking that it's sort of like getting an immunization. We don't know if it'll be like the flu, where every year you'll need a different one, or whether it will become less virulent every year, which is what happens to coronaviruses, we're hoping. So yeah. I also just want a housekeeping point for a moment. I see people posting under Q&A. I don't go look over there. I mean, maybe, so go put under chat. So, and if you've posted a question under Q&A, put it under chat, open the chat box and post it. Okay. So yeah, I don't know how long the immunity will last, but I think you'll be, but I unless something changes that makes this drastically different from historically the way things have worked with viruses, you should be fine for the summer and the fall. And we anticipate you will be. Are there recordings from previous week's calls? Absolutely. So every week when I do this, we put it on YouTube. And so you can go to YouTube and just search, Dr. Susan Blum Friday office hours, and you should find them. Okay. So we put them on YouTube and they're public. For your patients that get your test kits, how quickly do results come back? So first of all, I don't have the kits yet, although we sent out our first throat swab from a kit that we have in the office. It's supposed to come back within 3 days of them receiving it. And so it's an overnight shipping by FedEx. They say 24 to 48 hours unless they get backlogged, then 3 days. And so that's the turnaround time on that. But I'll let you know because we sent it out yesterday. And so next Friday, I'll tell you how fast I got it back. And so we'll tell you how fast we got it back. My integrative doctor said that there isn't an immunity test available in his office. Can you say what lab is offering the test? Yeah, and so the test that's offering it, the company that's offering it is called KBMO. There's two actually. KBMO Diagnostics is the one that right now you can get a blood draw one, right, where you can do it in the office. So that's what I have now. The finger stick kit is coming in the next week or two. They're making sure, they have to do studies that make sure that the blood draw one has been validated and they have an emergency approval from the FDA. But now they have to just prove that the finger stick is as accurate as the full blood draw. Okay. And so, so that's happening. So I expect that's going to happen in the next week or two. And then those kits can be drop shipped directly to patients. Like I just go on the website and put in the information through my account, and then the kit goes to you. And so we're going to make there'll be a way, once those kits are available, we're going to make a way that the public can get it from us. And do maybe just like a 15-minute mini immune consult, antibody testing screening, so you can become a patient of the office, and then we can order it for you. So you can tell your doctor to look at KBMO and open an account with them, and they should be able to get kits. The conventional medical world doesn't know about this. So KBMO, I've been using them for finger stick food sensitivity testing. So they've been doing finger stick technology forever. So I can send people their finger stick food sensitivity test, which is an IgG test. So they've been doing immune testing. And so they just sort of switched to look for a different immune thing, right? So these are a lot of the functional medicine companies have a finger stick technology they've already been doing for immune testing. So they just now are switching to look for this immune to COVID. Regarding immunity, you previously said people with a mild exposure to the virus are likely to have mild symptoms. How does it affect immunity? Does this mean they have weaker immunity? Okay, let me clarify what I said before about that. I said it might be, that I'm suspecting, I don't have any evidence for that if you have a very mild exposure, you only get exposed to a little bit of virus, that you might not get as sick as somebody in the hospital. It's sort of my way of trying to make sense of why the healthcare workers were all getting sick. And we're getting sick more frequently. And I don't know that people have, that they're so at risk there. And it might be just because they're seeing more people and they just have so much exposure, but they're getting disproportionately sick. And so I wonder whether or not they have the magnitude of the exposure matters for how sick they were getting. And so that's the first answer to your question. So I don't know for sure, and I haven't seen any studies yet about viral load. This idea about if somebody who's really, really sick and has a big viral load coughs right in your face, if you'll get more sick than whether or not you just touch somebody who's almost better and has not much virus anymore, and that you touch something, you touch them or they breathe on you and you get just a little bit of virus, whether or not you'll get less sick as somebody who, had a big dose. So I'm wondering if the dose matters, and I don't have the answer, but it's something that makes sense that it should matter. So that's the first. I just want to say that. The other part about how does it affect immunity? It's looking like people, the immune response that you make is not necessarily has to do with the exposure you had or how sick you got or whether you were asymptomatic. Maybe you were asymptomatic because you had such a big immune response, right? And it took care of things. I think the amount of immunity or the amount your immune response or whether you'll end up really robustly immune. And this is where the studies they're working on right now, understanding who, if everyone ends up really strong immune or who doesn't, has to do with sort of what we were talking about before, about the resiliency, about the biologic factors of your underlying terrain in your body. How strong is your immune system? How well are you able to make an immune response? And so I think that it's your terrain and your modifiable lifestyle factors is what's going to make a difference for how robust your immune response is. Not so much, I don't know about the dose and, I don't know about how sick you were, because it might be you were really sick because you didn't have a strong immune response. And it has to be part of the factors, right? So you see how that confounds it. So a really strong immune system that has a really robust immune response, whether you had a small dose or a large dose, can be why you didn't get sick. And so that's the only thing we can do something about, which brings me back to, the foundations of a healthy immune system. Your nutrient status and your nutrition, how well you're managing stress and your stress system, your health of your gut microbiome, and how high your toxin load is. Because toxins, if you're filled with toxins, it's terrible for your immune system. Okay. Do you also have to become a patient to get the antibody test? Yes. Sorry. I can't order a test for somebody who's not a patient. Eventually, the antibody test, I'm hoping, will be widespread available. It just depends on the state you're in, and I don't know you can count on the federal government. I think it's going to be a while before Quest and LabCorp have it. They're trying to catch up on just the viral testing, the COVID tests. They told us they're not even working on the antibody testing yet. And so, yeah, so you have to be patient to get the antibody test. But we made a really easy way. I'm trying to figure out just a screening visit that's like very inexpensive, to just but I need a practitioner to talk to you for 15 minutes. So we're working on that. I want to help you, I want to help make it available to everybody and provide a service, and I'm trying to keep my business afloat too. So I'm trying to figure out ways that I could, make us reduce the barriers to entry so my team can all be here to support you, reduce our prices, make it easier, make us more accessible, and provide this service while still being able to pay everyone's salary and keep everyone working. So it's sort of it helps us too, keeping going if you want to order it from us. So I just started hydroxychloroquine 50 for my lupus. Do you think this could really help me feel better and make it manageable? Maybe, I don't know. And is it true they think that people who take these meds, if think that people on this med may not catch COVID, but if they do, that they end up not getting as sick? Dr. Oz said that. Also, one last question. Okay, so Plaquenil, that's the hydroxychloroquine. There's a study right now looking at using hydroxychloroquine for prophylactically with healthcare professionals with zinc and vitamin C. And so it's possible hydroxychloroquine might work prophylactically in people who, meaning prevent you from getting it in people who are exposed every day. So they're doing, but they're giving like 200 milligrams every 3 weeks. Like it's a very small dose in the study. And they're looking at it, using it for prevention for people who are at the front lines. I think that for you taking it actually might help if you got exposed, if you're taking it every day, because it looks like it might work in an antiviral way. It prevents the virus from latching on. I mean, the way that it works. So I think it's fine that you're taking it, and it might help, but we don't know yet. And I don't know if it's going to help your autoimmune. That's for you and your rheumatologist to decide. If they gave it to you, maybe. For people with autoimmune or rheumatology issues, why they start Plaquenil, a lot of times it takes a while to build up on the full dose, and it takes a couple of months to see a difference in your symptoms for those medications. And so I wouldn't hold out hope that in the next week or two you're going to notice a difference in your symptoms, but I would assume your doctor told you that. One last thing, does using cannabis vape oil, does that put me more at risk if I catch COVID? Is safer than smoking cannabis? Ooh, I wouldn't be bringing anything into your lungs. So no vaping, no smoking. If you need to use cannabis, you should be doing edibles. Okay, no smoking, nothing. Any smoking or bringing anything into your lungs can create a little local inflammation, and we don't want that. Okay. Did I hear Dr. Blum correctly that we will be home quarantined until we have immunity or a vaccine? No, I didn't say that. Nope, I did not say that. What I said was we're home during mitigation. The next phase is going to be surveillance, and there needs to be a surveillance sort of policy put into place. And once that's in place, which I think will start this summer, probably I'm hoping by June, at least here in New York, there'll be some, I know they're working on it. They know what they need to do to get surveillance practice in place. Mitigation eventually leads to surveillance. It's step 2. And there's a checklist of things that need to happen from the public health department in order to have an effective surveillance program. And so everyone's working diligently, I know, here in New York to create an effective surveillance program and get ready to move out of mitigation. So that's what's going to happen next. But, during surveillance, the highest risk people might still want to work from home until they see it's all working okay. If you're one of those people with lung disease, cardiovascular disease, had a heart attack, have high blood pressure, have diabetes, have obesity, insulin issues, all of that. And so, and are on immunosuppressive meds. You know who you are. The list of people at the highest risk, emphysema, chronic bronchitis, pulmonary disease. So you will be careful. So there's going to be a modification in the quarantine. Some people go out, some people are immune, some people will be careful because they're low risk, and then the testing, to keeping a really good way of, as soon as someone has a case, they get quarantined at home. So only cases are quarantined during containment and their contacts. If someone had COVID-19 and is immune, can they still transmit it to others? I explained that to people. I sort of explained that before. It depends on how long ago you got sick and whether you have IgG. There's IgM, and I'm saying it again, just to make sure you hear it again. Once you have IgG, chances are you're not going to be contagious anymore because it'll have been at least 2 to 3 weeks since you had the virus. But if you know when you got sick, you want to wait 21 days from your first symptom before you go out. Okay, and there's different guidelines on that, and I'll keep updating that every week. Reading some doctors believe that the ventilator might do more harm than good. It has been mentioned that the lungs do not look like pneumonia, looks more like high altitude pulmonary edema. A different protocol being used, yes. And so this is sort of news that's been percolating this week. So there's not really a question, it's more than a statement, but I'll just sort of riff on that for a minute. We're learning more about what we call the pathophysiology of the pneumonia of COVID. And the way it was initially treated, thinking everybody had ARDS, which is acute respiratory distress syndrome, the patterning, or what they're seeing and what they're learning about what's really going on in the lungs, it's sort of not exactly like that. And it looks more like hypoxia, or what people get from acute altitude sickness, which requires a different setting on the respirator. And so what I've been reading is that the really brilliant people in the ICUs around the world, certainly I know in our country, but they're talking to everybody. Everybody's talking to each other. There are actually people, there's type 1 and type 2, and they're trying to split people into 2 different types of respiratory distress. And they're experimenting with the different settings for some people who need just a lot of extra oxygen and less push on the airway. And maybe that's why we're seeing less people ending up in the ICU or people getting out of the ICU. We're seeing just better treatment. So I think our treatment of how we're using the respirators is changing, because we think we don't need to be as, the way we treat this pulmonary piece is changing in the ICUs. And this is another part of treatment that I thank you for bringing it up to mention, that we're learning a lot about the best way to use the ventilators. And actually, if we don't have to use a lot of PEP, which is positive end expiratory pressure, so it's like pushing the air into the lungs at a very high push, that's not good for some people. And they're stopping doing that now. And it allows them to split one respirator for two people, because you just need a more gentle setting. So it's actually, the way we're treating this is changing in a good way. Will you stay in quarantine if you test and don't have immunity? Will me? If I test and don't have, me. If I am not immune and, no, I'm going to go back to work, but I'm going to put a lot of things in place once I feel containment's working. So what I told everyone earlier in this, so my feeling about it is I will come out of quarantine when I open Blum Center. And I will open Blum Center once I will start going back and seeing patients in the office. Once the containment strategy is working and in place to my satisfaction. And what that means is, everyone who's sick gets a test easily and with results within 2 days, no barriers. Drive-up testing is available to everybody who needs one. So adequate testing, with a good public health crew that's working to keep people contained. And the case rate has dropped below, the R0 is below 1. And so which is just the infectivity and the number of new cases drops to a low enough number. And so once we officially in New York switch from mitigation to containment, and I feel that the public health strategies are working, I will open my office, but I'm going to screen everyone's temperature when they come in. And my team, I'm like crazy keeping an eye on everyone, about where they're at and what we're doing. And I'm going to use I'm going to continue to be careful at the store. Like, there'll be things we'll do, and we'll talk about that. You're going to hear from me every week, right? So every Friday, and you'll know when that time comes and what I believe, when I believe it's safe. Supplements, let's see if we're almost done. Oh yeah, I went over time. You see, it's very hard not to. Supplements to diminish cytokine storm. You went through a supplements really fast. Is the list available on your website? Yes. So go to my website and just go on the blog. Okay. I'm updating this. This is still updated from last week. I updated my blog on the website. We always are posting new blogs, so you can just scroll down, and my blog was the last one that was up. I think that's the one on the top. Either of my websites have at the top blog. You get to the same blog on either website. If you've had kidney stones, can you still take vitamin C? The answer is yes, but be careful. You would probably not want to go to the highest doses of C, but you should be able to do 1,000 now and go up to like 3,000. I had kidney stones, and I'm taking C. I got rid of my kidney stones by becoming a vegan. So it's actually plants, it's actually animal food and an acidic diet that gives you kidney stones. So try eating more plants and then taking vitamin C. I'm concerned that folks who keep using Purell are also getting rid of natural bacteria, which we need for many reasons. Any comments? For now, don't worry about it. And it's just on your hands. The rest of your skin is still going to have natural bacteria. Just keep using it. It's too important for now, and I'm using it. I don't like all the ingredients in it, and you just do it because it's more important. Please consider recycle your plastic bags. Many grocery stores have recycle bins near one or more of their doors, whether or not we are in social distance rules. Good idea. And so when you get rid of all your plastic bags, you can stuff them into the bag you're going to bring back to the store next week. You can put all the bags away. 3 days later, the virus is gone. If you're going to the store once a week or every 2 weeks, you can it's clean by then. So just have a corner or your garage or wherever you want to stick things to let them just decontaminate on their own. So you can save those plastic bags. Sorry, I shouldn't have said to throw everything away. Question was incomplete. What is the physiology of the cytokine storm, and does it usually only occur in immune-compromised people or people at higher risk? Cytokine storm, we don't really know why. Yes, cytokine storm is when the immune system goes, it's like a runaway train where the immune system is reacting to the virus and it just overreacts and like keeps going like a storm. The cytokine that's released is called interleukin 6, so we know that. And that's why some of the supplements that I say that we talk about that can reduce interleukin 6, that's the quercetin and the curcumin and vitamin C. And there was one more, melatonin, right? So, so the people more likely to end up in cytokine storm, those are the people that go into the hospital. There are two kind of folks that go into the hospital. One just needs sort of oxygen and sort of do okay and sort of have a slow. Other people come in and they go down really quick. Those are the people in cytokine storm. And the people at the highest risk levels, so the people with the high risk that I keep talking about, the diabetics and hypertension and the obesity and cardiovascular disease and lung disease, those are the people more likely to go accelerate into a cytokine storm. If you're so you're at a lower risk for it if you have a good resilient immune system and your risk factors are low, like I was talking about gut health and detox, and you're taking good care of yourself. I'm currently doing a 30-day Heal My Gut program. Good. I'm planning to follow it up with another month as I have psoriatic arthritis. Excellent. Is it safe to do another month at this time, or would you recommend just sticking to 1 month at this time? I should state that I am a home care physical therapist. I'm going out of the home to see patients. If I get sick, would you recommend to stop? No. Heal My Gut will not damage your immune system in any way. Keep going, because it'll be protective. Because it's going to help, it's going to keep repairing your immune system. So especially if you've got symptoms. So you can do it that way. Make sure you're taking a lot of vitamin C if you're going out of the home, and zinc for sure. Can you please recommend supplements for sleep? Can you take zinc carnosine for immunity? Yes, you can use zinc carnosine, which is good for ulcers and for your stomach lining. That will provide zinc for you, so you can use that one. Supplements for sleep. Geez, well, I'm using, I give people all sorts of things. Melatonin would be a good one to try because it's good for your immune system also. So it'll do double duty. You can do herbs like valerian, passion flower, lemon balm. You can make sleepy time tea. You can take that as a tincture or as a supplement. I like valerian. I use something called myocom from Metagenics in my office. I use for anxiety, theanine's really nice. I'm using a lot of CBD these days, to help people sleep, especially if you're really worked up and very anxious. But I usually go down the list and say, try melatonin first, see if that helps, and then try valerian products, see if that helps. And then if really people who are really stuck, I often will move them over to CBD. Are you familiar with Metagenic SPM Active, and would you recommend taking this at this time? SPM will help turn off it's a different inflammatory pathway, but I like SPM Active for inflammation. And it helps resolve inflammation. And so if you actually have inflammation in your body, that's not good for your immune system either. So if you have if you feel inflamed, you have joint pain, you have inflammation or inflammatory disease, then definitely take it. It will definitely be good for you. We have friends in California who said their doctors are getting antibody tests from Europe. Is there a difference in those tests versus the ones being developed here? I can't really answer that. I think that the most important thing is I actually did get a box of 25 tests from China. We're testing that one out in the office. The most important thing is I think it's okay to be getting tests from wherever we can get them. There's data. Each test comes with its specifications. Let's say you get you have to ask them for their quality control information, and you have to trust that your doctor is going to read that. And so there's something called sensitivity and specificity. They're public health terms, but it tells you the rate of false negatives and false positives, and that's how you know if it's a good test. So it doesn't really matter where the test comes from. You just want to be able to assess it as a doctor and know whether or not it has a good specificity and sensitivity. Meaning if it says you're positive, that you really are, and if it says you're negative, that you really are. And you want both to be at least around 90% or higher. Or high 80s would probably be okay. And so So I'm using that quality control and screening the tests that I'm getting. I'm making them show me the data. And so you have to trust your doctor to be determining whether they feel it's a good test based upon the company providing them that information. So it's not about where the test comes from. It's about making sure it's a quality, the test is showing the adequate quality. Because if you get the test and it says you're immune, you want to believe that. That's the problem. That's why it's taking a while. That's why it's taking a while to get the test available to everyone. We have to make sure that if the test says you're positive, you really are, because you're going to go out, right? And you don't want to get sick again, right? So we want to make sure that if it says you're immune, you really are. And if it says you're not immune, you know that you're really not. And so it's called false negatives and false positives. So that's how you screen the test, not where it's coming from. Is there any quick test to test a person's viral load? Ideally, finger stick or swab. I've been reaching out to companies, Genova. It's not so much viral load. It'll test you whether or not you have virus in you. The two companies I'm aware of right now is I'm getting the throat swab through Apiriomics, APERIOMICS. And so we had an account with them already, so we're getting kits from them for that. The other company is Diagnostic Solutions that does the GI map test. They're rolling out a stool test looking for virus. I'm not jumping on that one yet because I actually haven't seen studies that correlate to whether, if it's negative, it really means you don't have any virus, right? Some people pass it in their stool and some people might not. So I'm not sure about that test yet, but they have it, and I'm waiting for more studies about about looking at correlating that. They have to do the stool versus the swabs to prove to me that if that's negative, that I can say, go, you now don't have it and you can't spread it. Yeah. So Apiriomics is the only one that I have that has a kit that I can send people. And it's not a quick test in the office. The quick test that I have in the office that you can read in 15 minutes, it's like a pregnancy test. You put a drop of blood and then a bar it's like a line that goes up in 15 minutes. That is that's the company I got from China. I don't even have the name of a company for that, but I had a contact who got that for me. My home is being renovated. If one of the workers gets corona, how long do his germs remain in the home? Well, you should make sure, so you're living there with people coming into the house. So here's what I would do. I would make sure they were all wearing a mask. And before anybody walks in your door every morning, you should go online and order a temperature. It's an infrared thermometer. And you go up to everybody in the morning, or you ask your subcontractor, the head of the subcontractor people, you give it to them. And everybody that comes on site gets their temperature taken. Anyone who's 99 or above cannot come to work. So that's it. And so you'll screen them. And if they're all wearing a mask and you screen, that's what they did in Europe. And it really works. The temperature screening is the single best way to make sure that nobody sick comes into your house. So that's what I would do. That's what I'm going to do in the office. And they're available online. I saw the infrared thermometers are still available. I'm taking zinc currently 30. Do I need copper too? Yes. So now if this goes on for a long time and you continue to take zinc, you can imbalance your zinc to copper ratio. So you might want to then make sure your multi has like 2 micrograms of zinc in it, right? It's like usually we say like two of zinc for every 30 you don't need more than 2, I think it's micrograms of zinc. But yes, eventually, like for this short term, for like a month or 2, you're fine taking zinc by itself, but eventually you're going to want to add copper, and that's a good point. One of the things you can do, I'm taking zinc in my multi. So my multi has 30 of zinc and 2 of copper. So that's just the way I'm taking it. If you're taking a separate zinc, that's fine. Just make sure that you have eventually, for this month, don't worry about it. But as you refill, you can look at getting zinc from a multi. You can also do a multi-mineral. The one we use is called LDA Minerals, and it has 30 of zinc and 2 of copper. Has a little bit of iodine for your thyroid. It's like a multi-mineral, and selenium, which is really good for your for antioxidant. What's the best products to wash produce? Water. There's not everything I've read, water is just fine. So what other medication besides immune suppressors decreases the immune system? Did you say last week it was one of the over-the-counter non-steroidal anti-inflammatory? No, last week I said the non-steroidal anti-inflammatories we're saying not to take those because somehow people that take those have been anecdotally, we think it makes, it's not, I don't want to say it increases your risk for worse severe symptoms, but the sicker people, it somehow is not good. It's not as good for your process. If you get sick, don't take the nonsteroidals or Advil or those, because people who are sicker looks like they took those, right? So increases your risk of getting sicker. So that's that. And so that was really the one I was talking about. The other thing is the DMARDs. It's all the things, the disease modifying anti-rheumatic drugs. And so these are things like the I always call them the IMABs, that I always forget those names. They're using them now. They're actually using them now for the, where are some of those names? I'll tell you. Kevzara, Actemra, Jakavi, and then there's Otezla, like all of these psoriasis meds. I mean, they all suppress your immune system. And so people that are on, you know who you are, that are taking medication for your MS, for your rheumatoid arthritis. A lot of people are on these very strong medications. They're trying out some of these for people in cytokine storm because they want to turn it down. But at the very beginning, when you first get exposed, it might not be a good thing. Okay. Are those working in the grocery store going to be receiving the low dose Plaquenil? No, only hospital workers. People in the grocery stores are not coming in contact with sick people like people in the healthcare. The people in the hospitals have exposure to virus that's crazy. The people in the stores, I mean, they need to be social distance. They need to be careful and wear masks and to practice social distancing and good hygiene. But no, I've been in isolation for 25 days. I'm almost done. For 25 days with no contact with anyone in my home. My best friend has been in isolation for 23 days in her home. Can we get together in our homes? Yes. And or with her 81-year-old mom, who also has been in isolation in her own home. We have stayed apart this whole time and not ventured out. Groceries delivered, working from home. I think so. I think that's a nice way to start expanding the social isolation. If I call it, it's like, remember that what I was joking about last time about meet the parents, that whole circle of trust, right? You develop this circle of trust. I have a circle of trust with my people in the office. I have 4 people going in every day. And I know where they are. I know what they're doing when they go home. We have all an agreed circle of trust that they're quarantined at home, and then they all go into the office. They're staying separated in the office. They have different work areas completely. So, but there's a circle of trust. And so as long as you have a circle of trust with other folks that are by themselves and you want to get together and even start living together during this, and combine, and start just being together, that's a great thing. And so if you've been quarantined this time and you're not going to give it to each other, especially your 81-year-old, her 81-year-old mom, I think so. Okay. You're good. We have stayed apart. Good for you. What is the difference between containment and surveillance program? Containment is, I'm not going to go into that again. Go back to the beginning of this recording. Containment is the same term as mitigation. Right? Nope. Mitigation is more slowing the curve. We'll say containment and surveillance. Yeah, sorry. Scratch that. I've been talking for a while. Containment is the next step after mitigation. That's what I've been talking about. Surveillance is very similar. Okay, so surveillance is when you test everyone. As soon as there's a case, you quarantine them. That's surveillance. So containment and surveillance, let's call that the same thing. Okay, so thanks for that question. Do you know if the ACE receptor is involved in the lungs or what the physiology? Don't worry about the ACE receptor anymore. That was a dead end for supplements, and I haven't read much about that this week. If there's anything new about that next week, I will let you know. If something breaks in the house, but you are older and have been self-quarantined for weeks, what to do? Breaks. Would you let a repair person in the house for broken appliance and broken air conditioning? I would say yes. If you're, you just have to be very careful, right? And so you stay far away from the person. let them in the house, let them fix it. Just make sure that they have, make them Purell their hands as soon as they walk in. You leave it by the door, make sure they're wearing a face mask, make sure they have gloves on and that they wash their hands. And then they come in and you stay very far apart from them. But if it's something you really need, like air conditioning, depending on where you live, or you need your dishwasher, then let them come. But just be really, really careful. And as soon as they leave, you wear a mask while they're there, stay far away. And as soon as they leave, you sterilize the whole area where they've been. And make sure they have a mask on. I mean, I would say for the most part, that's the case. Is it safe to use melatonin if you have hair loss issues? Yes, you can use melatonin. If you have closed caption, and that was from Liz Mary. Do you have closed caption available for the recordings? Because I don't always catch the medical terms words. I'm sorry. No, and I don't have a transcription service, so I don't think there's a way to do closed captioning. I'm sorry. Thank you for all the amazing input. What multi do you recommend? Do we wear masks though? Thank you. Yes. Always, like, definitely wear masks when you leave the house. I don't know. Tara. Oh, that was the isolation. No. Once you're with everyone, and once you come back together, all three of you, and you're with each other, and you're only in your own homes and you're only together. Once you get in the house, you don't have to wear a mask. But I would just wear one when you're going between places. And even when you're in the house together, you should still stay, like, you don't need to get too close together, right? But you can be together. So virtual hug to you as well. And my last question is the multi. There's a lot of good multis out there. I like Pure Encapsulations has a 1 a day. I like Designs for Health has a 2 a day. A 2 a day multi. You just take the twice daily, it's called. I like Mitacor from Orthomolecular. I like Phytomulti from Metagenics. I like a lot of them, so you're good. All right, I'm going to sign off here. It was a whole hour and a half. I think I got everyone's questions answered. Take care, be well, and I will see you all next week.